Good evening, everyone. So thank you for coming tonight, and also to our virtual streaming audience for tonight's screening of our documentary, The Vaccination Against the Misinformation Virus, and there is a lot of misinformation out there. So again, thank you again for coming tonight. And I'm going to introduce the producer and director of the show, and then he'll introduce the movie. So Chris Schuler has created over 100 television programs in the past 25 years that have won 26 Emmy Awards and have been broadcast throughout the United States and in 35 other countries. Focusing on educational and social issues, Mr. Schuler's documentaries have raised public awareness and impacted public policy nationally and internationally through partnerships ranging from the United Nations to the National Institute of Mental Health and the PBS Network to the CBS Network Foundation, as well as other networks and governments worldwide. He has directed documentaries in Asia, Africa, the Middle East, Europe, and Russia, in addition to many national and international awards. With his unique focus on social issues, he has been named Innovator of the Year by the National Broadcast Association for Community Affairs. So, Chris, please come on up.
Thank you, Doug. Thank you so much.
Oops,
Use this.
Use both.
This is for the online.
That's online.
And this is for here.
You got it.
Good.
Okay.
This is good. It's interesting. We've been doing this around the country. I'm so glad we could do it right here. And Dawn, thank you so much for organizing all this. And you'll meet our panel of experts. We have the country's best, if not the world's best. And you will see them in the film, and then you'll meet them in person. And then as we go through the film, think of any questions, because we're going to have a bit of time afterwards, and we're excited that they're here to answer these questions. I wanted to tell you just briefly how this all got started, and it's Walter Doherty's fault. 2017, he called me up. We were working on a project about, I believe, childhood obesity at the time, and he wanted to take me to lunch, and he said, we need to do something about vaccinations. He had a group of students who had done a study over the last, was it 50 years or was it 90 years? 90 years of film and television's portrayal of vaccinations. And it was quite fascinating. For those of you old enough, Errol Flynn, way back when, was the one who discovered the vaccine that saved the community or saved the world, right? And now this is sort of the 180 degrees. When you look at movies like Legend, where whoever does the vaccinating are the bad people and people turn into zombies, and that's sort of the portrayal that's changed in the last 90 years for television and film. So we were looking at how to deal with that. This was in 2017. When the pandemic hit, we knew that the urgency was even greater. So at that point, we had done a lot of research and work and think tanks with pediatricians and infectious disease people and all sorts of folks. At that point, I met Admiral Pamela Schweitzer, who you'll meet more in just a little bit, and she started connecting us with people all over the country. So we'll take a look at the film, and then we're going to bring up our experts, and then we'll have time to discuss and talk and answer questions you may have. And then we have a challenge for you as well. And that is going to take all of us to get the whole world vaccinated. And we'll talk about that in a little bit. But thank you so much for being here. And without further ado, we'll take a look at the film. Thank you. Oh, sure. Go ahead.
Our lifespan for most of humanity
was short, right? We had 40 years if we were lucky. And 45% of kids, depending on the era of history, died before the age of 5. And when you think about our lives, we get to see our children and our grandchildren grow up. The expectation is if you have a baby, you're going to get to see that baby grow up. That wasn't always the case. So the idea that we get these long lives, we get to see our children grow up, we can expect to see our children grow up. This is a gift of science.
You know, I think we've forgotten a lot of lessons that we've learned over the last 100 years since vaccines were developed. There was a big polio outbreak, devastating. Then we developed the vaccine and we called it cured. We were free of polio. Likewise with measles, mumps, rubella, scarlet fever.
The medicine that has saved more lives than anything else is vaccines. Not insulin, not antibiotics, not medicines for blood pressure. It's vaccines that have saved the most lives. It's really a remarkable contribution to human health.
Funding for this program was provided by Presbyterian Healthcare Services, STC Health, the City of Albuquerque, and Safe Team New Mexico. Additional funding was provided by these generous underwriters.
It's now possible, for misinformation to appear on your computer screen and for you to quickly share that with 1,000 of your closest friends. That's the basis for misinformation to quickly go viral. We're facing a threat from misinformation itself as a viral epidemic of sorts.
So viruses, many viruses are incredibly contagious. They can suspend in the air. People can cough, sneeze, or touch another surface which someone else touches, which is then accentuated if those same people board an airplane or a train, cross continents, cross countries, and then before long, you have a virtual explosion of the virus all around the globe.
This is truly an unprecedented situation.
This virus does not discriminate. It attacks everyone.
The coronavirus has changed life as we know it across America.
I want to talk about the fact that if anybody's doubting getting the vaccine, please get the vaccine. This is not a hoax. This is real. It's very dangerous. It comes on quick.
I've always loved math since I was a child. I always liked, I feel like the structured math is very structured and there's a lot of rules, and so I always liked that. I was born in Mexico. My parents are pastors, and so I moved around when I was growing up. When I was 16, my parents moved to New Jersey. It was a Spanish congregation, and they wanted a Spanish-speaking pastor. I went to Cornell University for a summer program, and that's when for the first time, I was introduced to the fact that you could use mathematics to study infectious diseases and epidemics. So this is one of the computer simulations that we developed in early 2020, showing what would have happened if we lifted some of the restrictions in June 1st of 2020. Some of the restrictions that we included in our simulation included school closures, business closures, and mass gatherings. And so if you actually lifted all those restrictions on June 1st, you would have seen a secondary wave of infection. So I don't know if you've ever been to a restaurant or the park or a concert, and all of a sudden you smell smoke. You know that there's someone smoking in your vicinity. And so that's exactly how viruses spread. Because you can't see them, you can basically inhale those particles, then you could potentially get infected. So this is a social contact network of 2,000 people in California. And these are connections that they have, their kids have at schools, the parents have at work, and friends, or when they go to Starbucks and they meet other people at other places. And so you can see how highly connected we are. We actually touch our faces a lot, our mouths, our noses, our eyes. There was a study that was done, and they decided to use healthcare workers because they're supposed to be more aware of hygiene and viruses. And they noticed that on average, they touch their faces about 23 times in an hour. And face masks are actually protecting your mouth and your nose. And so even if you feel the urge to touch your mouth, you won't be able because you have something that's blocking your hands and your mouth. And so that's why face masks are very effective in helping us, in protecting us from getting infected. The spread of flu starts at airports, major cities, and then it soon starts spreading across the United States. Vaccinations help slow the spread of flu and all respiratory viruses such as measles and coronaviruses by removing bridges or connections that we have in our population. We're all interconnected. And when we get vaccinated, we are basically breaking those bridges or those connections. There's a very important number that determines how fast an epidemic can spread or a virus can spread, and that is the reproductive number. And so if the number is less than 1, that means that the virus cannot spread to even one person. But if this number is 1 or 2 or 3, then you have an exponential increase, and that means that one person can infect 3 people, and then those 3 people can infect three people, each of them. It varies from disease to disease. So for flu, it's about 1.2. Measles, on the other hand, the reproductive number is between 12 and 16. So one person can actually infect, on average, 12 to 16 people, and it's usually spread among children.
So the first effective measles vaccines come along about 1963 or so, and widely adopted. Now, let's come into the 2000s or so, and measles disappears, sorta. People forget about measles. It's not, your cousins don't get measles. You don't know kids in your class who got measles, and so some parents become complacent, become confused, and thinking that the measles vaccine is a dangerous thing when it is not, and so they withheld vaccine from their kids. Those kids accumulate, and just like a whole bunch of tinder out in the forest, you throw a spark of a virus amid a bunch of vulnerable kids, and you can have an explosion of measles cases, and that's what happens. The Disneyland outbreak from a few years ago.
We did everything right. I got my flu shot when I was pregnant because I was worried about pertussis and flu. And one of the first places we did a couple weeks after he got that first round of vaccines was Disneyland. We got married there. We announced my pregnancy with him there. I'd wear him in like the little baby carrier, and he would just look up and he was just looking and listening and smelling and just very engaged from the first time we took him. I remember waking up, it was on Super Bowl Sunday 2014, and I put my hand over and just kind of, touched him because I woke up, and he felt really warm. And he had a bunch of spots on his chest. And I was, at that point, measles had been in the news. So I was kind of like, I was like, no, I'm crazy. There's no way. There's no way that my baby has measles in 2014. And then the spots kind of got worse. They started kind of spreading down his trunk, and he had a couple on his face, a couple on his arms. I had no idea that measles could kill you. I had no idea. I went to nursing school. I had no idea because I've never seen it. I've never met anybody that, recently had it. I knew it was really contagious. So I called the ER before we went, and I said, I think my baby might have measles. I can't get his fever down, and we want to come in. The doctor had never seen measles, none of the nurses had ever seen measles. They were in the full PPE and taking it, again, very seriously, which was also terrifying. So they collected some blood, and they gave him some medicine and watched him for a while. He was doing okay, so we went home. 4 days later, it took 4 days. So his spots were starting to get better. He was on the upswing by then, but his eyes itched. We had to take him to like an ophthalmologist and just to make sure he didn't have any eye damage, because you can get pretty serious eye complications from measles.
So this is a disease that was pretty close to being eradicated. And then we started to see a trend where people weren't getting vaccinated. So we've subsequently had some measles outbreaks starting in 2000s. We had a small measles outbreak here in the Baltimore metro region back in April of 2020. Again, because we're seeing less and less people get vaccinated, and it's a highly contagious disease.
Which is why that it's important that each and every one of us is vaccinated against everything that has a vaccine. But over the last 2 decades, there's been a lot of pushback against vaccines.
I've spent the last year taking care of patients with COVID-19, and it was really hard, being a nurse, having spent years advocating for vaccines and for, public health, seeing people not taking it seriously, and still seeing people not take it seriously. I know they have been spending years developing mRNA vaccines, because I was working in a respiratory ICU, so I was one of the first ones to be able to get it, and I was so happy and so relieved. So I trust science. I trust, the people that have spent their entire lives developing these vaccines and studying science and doing it the right way. So one thing I, again, didn't realize about measles is that not only can it kill you right then when you're actively sick, but it can kill you years later. The younger you were when you got measles, the more likely it is to happen and feel a little safe. But every time that he was starting to get a little bit of a little cold, every time I'm like, is this it? Is this it? So yeah, so I've spent the last 6 years being afraid that he could still die from measles.
If enough people are immune, then it's hard for the virus to jump from one person to the next. With a virus like measles that is extremely transmissible, you have to have 95 or more % of the people protected, immune, to prevent transmission. Other viruses aren't quite so transmissible. You can get away with a smaller number. Herd immunity is about efficiency, and some of that herd immunity is being contributed by people who have had the disease before, some by people who are who've been vaccinated. But then the number is going to change based on whether, am I wearing a mask? Are you wearing a mask? How far apart are we? Am I singing at church and sending out droplets? All of those things, it's not like there's a magic number, because the people keep moving around in the society and doing different things, and that number's probably different in different places on different days.
If you are engaged with the world just through a search engine, that's going to be a different lens than if you are regularly paying attention to people and institutions and sources that you have put your trust in over time. There is value in well-done professional journalism. There is value in academic research. We know who's putting that information together.
So I have a PhD in microbiology and immunology, and then I did postdoctoral training at University of North Carolina in Chapel Hill in medical and public health microbiology. I am a Christian in my personal belief system, and I'm a scientist. And there's some people who would say, how is that even possible? I believe, for me personally, my science builds and reveals my faith, and my faith reveals my science. And so that, for me, is this perfect synergy of saying, I believe in things that I can't see. I believe in things that I've not yet discovered. I believe in things that are still even only theory, but I work to prove the theory. Now, was I talking about my faith or was I talking about my science? They go hand in hand. One thing that we're really learning so much about right now is called the microbiome. And that is this whole interaction of this microbial world inside our bodies. So bacteria that are naturally occurring, they're inside of our body to keep us healthy. So we have microbes that are part of our natural community. And then we have microbes that are pathogens, and those pathogens are the ones that cause disease. And so vaccines, they come in to play because they are able to then help our bodies combat the pathogens that cause disease in our bodies.
So the vaccine is actually injecting a portion of the pathogen you're trying to prevent without that causing any damage. We can inject just that part. Not capable of causing disease, but it is capable of allowing the immune system to learn and practice on it so that when you actually do see the pathogen, you're prepared.
And we produce antibodies, we produce T cells that are able to recognize that pathogen in the future. So if we get it exposed to it again, the whole immune response will start over again.
Your body is learning. It learns from the vaccine. The immune system practices so that when the actual time arrives, when you're exposed to the real pathogen, it's ready to go, armed and ready for battle. So I don't think it's an overstatement at all to say vaccinations are one of the most important medical advancements in history.
So the first vaccine was 1796. Edward Jenner develops the first vaccine, which is the vaccine to prevent smallpox. And the number one killer of humanity in history was smallpox. And that becomes vaccine preventable if you choose to take the vaccine.
So the traditional narrative is that Edward Jenner noted that milkmaids had fair complexions and didn't have pockmarks because they weren't infected with smallpox.
Mr. Jenner finally started to put two and two together about the milkmaids. The women that were working with the cows were not getting sick from smallpox, or they were getting very mild infections and they were all surviving, whereas it was killing something like a third of the people that were infected.
So through the process of milking the cows, they would come into contact with the cowpox secretions and become infected, and then unknowingly that would provide them protection against the more dangerous smallpox.
From what I understand, the word vaccine comes from the Latin word vacca, from the cows, because of the cowpox story and the whole inoculation and things.
The real story is much more complex. The concept of purposely exposing someone to some infectious material to keep them safe from an infection actually probably went back several hundred years prior to that. The Chinese, Indian, and African societies had developed very similar technology. So Jenner didn't invent the idea of vaccination. He was the first to test it and to see the public health benefits, which were eventually shown to be true when 200 years later we actually did eradicate smallpox with a variant of his vaccine.
It's pretty obvious, even as a veterinarian, that as we come more in contact with wild animals and we start to expand our cities and our farmlands, that interaction with animals is going to get worse and worse. And so we have to worry more and more about these zoonotic diseases, diseases that can be passed from animals to people. Most notably rabies, which we know is a virus that's almost always fatal. One good way to protect people is to protect our pets and our animals, and that way it acts as a buffer. Having our dogs and cats vaccinated, and our other animals as well, protects them from getting infected, which then would protect us.
Hey Shannon, it's Monica from Native American College.
Hang tight, we got a couple of more sound checks to go, and then we will be live, so hold tight.
So we have a filming crew here, and they are making a documentary. This will be part of it, addressing some of the COVID-19 concerns, the vaccines, vaccine hesitancy.
So there's a break at 18 past the hour and one at 38 past the hour. I think she's starting with Shannon. Okay.
Native Voice One, the Native American Radio Network.
This is Native America Calling. I'm Tara Gatewood, joining you live from my homelands of Sherwood, Dewey. Today we are going to start off in Pawhuska, Oklahoma. With us today is Shannon Duty. And so Shannon, you wrote an editorial in the Washington Post titled "My Osage Tribe is Swimming in Vaccines, but the people won't take them."
Well, we are unlike many Native communities outside of Oklahoma. We have been spared of the worst of COVID's harms. Also, there is historical trauma here. There is mistrust of the federal government. In the 1970s, Native American women were sterilized by Indian Health Service.
Our people tend to trust our doctors overall, and so that's who they will go to. Our people will tend to trust our elders, and that's who they will go to. Our people tend to trust our traditional practitioners, and that's who they will go to.
Well, during my upbringing, I was raised around a lot of medicine men. My great-grandparents, my grandpa, my dad. So a lot of what I do has been passed down through generation. A lot of our old folks, they pretty much, they're still rooted traditionally in their cultural. So a lot of them still practice the old ways, the traditional side of it.
This inherent responsibility to care for people, to care for culture, to care for land, animals, every living being. That's the core of our concept of health and wellness. We have our own ways of healing. We have our own ways of accessing traditional medicine and traditional healing. But in this case with this virus, we need to supplement that with Western medicine, and it calls for vaccination.
Going out there and getting vaccinated is one thing that I think everybody should look at. We all want to be safe, not with just ourselves, but our little families that we have, our community, our elders.
Being on the front lines, I did feel that it was really important to get the COVID vaccine just to help with safety, not only for myself and my family. I wanted to make sure that even though I was taking all the precautions, wearing a mask and doing social distancing, isolating myself from the rest of my family, that I was also safe enough to see patients and not provide an additional risk for the patients to get sick.
Also joining us today here in Studio 49 in Albuquerque is Dr. Melvina Mccabe. And so, Dr. Mccabe, with this historic time, we get to a conversation that is quite important and also revealing about the history and the traumas our Native nations have gone through.
In our history, we have had governmental policies that have impacted this distrust from the government. We've had our treaties broken. We've had research, unethical behavior being conducted in research. We've had in the clinical practice, as Shannon mentioned, the sterilization of our Indian women in the 1970s, and this was without their consent, without their knowledge. Our Native peoples know this, but anyone who wants to work with Indian country, they need to be aware of this. Some of the things that I've heard, and I think Shannon mentioned this, is that these vaccines were rushed, so they're afraid that they're not safe. There were strict protocols, strict oversight. There are independent groups that monitor these results and give their opinions on it. And these independent groups are scientists. They're not part necessarily of the Food and Drug Administration. All three of the vaccines, the Pfizer, the Moderna, and the Johnson & Johnson, the J&J vaccine, all of them near 100% effective in reducing severity of disease. And severity is defined in this case as being hospitalized, being intubated, and even death.
On the line with us today is Susan out of Bethel, Alaska. tuned in to KYUK. Thank you for giving us a ring, Susan. You're on air.
I wanted to say that I got the vaccination as soon as I could. And when I have dialogues with others that have not gotten it or don't want to get it or hesitating, don't let it turn into an argument, but just keep the dialogue open and really listen.
Dr. McCabe, we know how things go in our tribal communities. They're seeing news reports, and the moment something adverse gets reported about vaccines, people are buzzing about it.
The first comment I want to make is that there's lots of misinformation over social media. Before just really accepting that, again, go back to asking your doctors whether or not that kind of information is true.
All right, thank you for that, Dr. McCabe. Also here out of Seattle, Washington is Abigail Echohawk. She is the director of the Urban Indian Health Institute and the chief research officer at the Seattle Indian Health Board. And she is Pawnee. Our pleasure to have her here with us.
Out of the people that we surveyed, we found that 75% were willing to get vaccinated. However, simply because they were willing didn't mean that they didn't have hesitancies. We have local, regional, tribal centers who are putting out really good information. Go to where the information for Native people by Native people is.
All right, thank you for that. Plenty more to be said. Visit us online, nativeamericacalling.com.
I think we're done.
Studies have shown that compared to the more traditional forms of media, such as television, radio, newspapers, wire services, which tend to present a positive portrayal of immunizations, more modern forms of social media, such as Twitter and blogs and websites, are more likely to portray an anti-vaccination slant.
When schools went virtual, many of our households now had access to the technology. Many of them did not before that time. And so as students were being issued Chromebooks and other technology, here was another resource for accessing that information available to the rest of the world. We started to see that there were some not so reliable sources of information that were being shared and being passed along from household to household.
Every year, there's about 120 million Americans that get a flu vaccine. If you follow 120 million Americans for several weeks after a flu vaccine, things are going to happen. Those 120 million Americans will get heart attacks, they might be diagnosed with cancer, they may get bitten by a shark or struck by lightning. Most of the time, that has nothing to do with the vaccine, it's merely a coincidence. The rate of those adverse effects are often just the same, if not higher, in people who didn't get the vaccine.
Vaccines help create antibodies to fight diseases.
There are several kinds of vaccines.
Inactivated.
Inactivated vaccines use the killed version of the germ.
Live attenuated.
Use a weakened or attenuated form of the germ.
Toxoid.
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 Create immunity to the parts of the germ that cause a disease.
Subunit.
Recombinant.
Polysaccharide.
And
conjugate.
Give a targeted response to key parts of the germ.
Viral vector.
Viral vector.
use a modified version
of a different virus,
to deliver protection.
like adenovirus,
which causes the common cold.
Adenovirus is used in some COVID-19 vaccines.
Now, going to the messenger RNA vaccines, which Pfizer and Moderna have, we have had the technology for the messenger RNA since 1990. So we've been working with this technology. The technology itself is not new.
So the science behind the vaccine has been working for 10 to 15 years. And now when we have a global pandemic, we take the science of the last decade and we build a vaccine based on that. And so while warp speed sounds good as a marketing piece, right? It sounds really good. Science never happens at warp speed. Science is always built by the scientists from before, and we take the backbone that was provided by each scientist and we move the field forward.
So we have many, many vaccines because we have many, many diseases. And so as we develop new technology, we see new vaccines. So we have now vaccines against human papillomavirus, which is the first cancer vaccine.
Vaccines protect you.
They are
effective
and
safe.
They protect against
hepatitis A,
flu,
Polio, rabies,
measles, mumps, rubella,
rotavirus,
smallpox, chickenpox,
yellow fever,
diphtheria,
tetanus,
hepatitis B,
human papillomavirus,
whooping cough,
pneumococcal disease,
meningococcal disease,
shingles.
Vaccines save millions of lives.
millions of lives a year.
We have motivations for the information that we seek. At the end of the day, people want to be right. And people want to have a sense that their worldview is one that is validated. So we can be blind to information that really is at odds with what we thought was the way that the world worked.
So a lot of individuals think that they don't need the flu vaccine because they've never had the flu. They probably have had the flu, they just didn't get tested to confirm it. Many people believe they get sick from the flu vaccine. Most flu vaccines, though, are not capable of giving you the flu. And so they probably are infected with something else which they mistakenly believe is flu. And so some people believe, well, if I have to get vaccinated every year, clearly it's not working and I don't need to get it. That's also a false belief.
Hope Pharmacy, Chantel speaking. May I help you? We'll process everything on Friday and have it out delivered to you on Monday. Does that sound good? Okay.
So I grew up in Henrico County, but I spent a lot of time here in Churchill. My church that I attended is cattle corner here from this building. So I grew up attending that church. And so it feels good to be back here in a community that I was with for so long as a child. But there's still a lot of need. This is considered a food desert where we are. When we talk about a food desert, lack of having access to fresh fruits, fresh vegetables. So you'll see that there are a lot of corner stores located here, but they don't have the healthy foods, and that's what we really promote here. As soon as you walk in the door, it's nice, it's bright, and we want people to really have that access to it, and the prices are affordable. And so for me, the first thing I don't always think about is the medication. What are we doing different with things that can prevent you from having to go into the hospital and having to take medication? And so that's what we're trying to really promote here, the healthy lifestyle.
So we have to call the doctor on the blood pressure medicine.
I am a firm advocate of vaccinations. And so HOPE, Helping Others Physically Prosper. That's what it stands for. And vaccinations is key because we're having others physically prosper through education as well as immunizations, from influenza, from pneumonia and shingles, all those things that the community needs.
So what I'll do is we'll get the others filled and ordered for you and have them delivered out to you, okay?
You look a lot like your mom. I know I know your siblings, the twins. So my girls, Morgan and Kendall. So yeah, we're here to give you the comfort that you may need in order to make the best informed decision for yourself.
We're done.
We're done.
I don't know why they said that hurt. People are dying. This is not a joke. So I went ahead and got vaccinated.
This pharmacy is bridging the gap between the old and the new.
We come stop that, so we can still take care of all your prescription needs, all right? All right, thank you. Bye.
I started in the Peace Corps in the Gambia, West Africa. I teach now, but I'm actually a practitioner by trade, so I spent 16 years in public health before testing. So for a scientist, they would think, why can't you see the connection between COVID-19 deaths and just get vaccinated? It's just that simple, but it's not just that simple. It is that sometimes people will risk dying over the chances of living from something that they know nothing about based on the trauma that they've encountered within the system. They tend to be absolutely against communities of color in general. We know that they are absolutely perpetuated against communities who are disenfranchised.
So I grew up in a colonia in southern New Mexico near the Texas border. Colonias are unincorporated towns. And so being unincorporated and rural and having a large migrant community means that there's a lot of poverty.
infectada, pero también quiero proteger a mi hija, a mi esposo y a mi comunidad.
I get vaccinated to protect everybody else. When I'm immune, it makes it harder for the virus to jump from person to person.
For every vaccine given, that's a potential life saved.
Weren't our experts incredible? Didn't they do a great job from here in New Mexico and around the country? Just amazing work. Y'all can come on up. Our panelists, Walter and Pam, Ori, Dr. McCabe, I know you're around somewhere. If you can come up that side, and then we've got socially distant spots here, and I think our guy's going to come out here and wire you up. Yeah, that's perfect. And while they're coming up, you may wonder how we got here. How did we get here with this whole misinformation stuff? It's quite amazing. And I want to tell you a story. We didn't have time for it in the documentary, but I want to tell you, some of you know it. In 1955, Jonas Salk was starting to test the polio vaccine. Some of you may remember this. And there were 370,000 parents getting ready to have their kids inoculated as the first test. And that Sunday night in April, there was the #1 radio show host at the time, Mr. Walter Winchell. Do you remember this? Walter Winchell. He would always come on the air and he would say, "Good evening, Mr. and Mrs. America and all the ships at sea." Everyone listened to this guy. 1955, April. And he said that night, in just a few minutes, I'm going to tell you about this cure for polio they're talking about. They're going to test it, but I'll tell you, it's a killer. Walter Winchell. And the next day, all these parents started pulling their kids out of the trial, right? And immediately, ABC, NBC, CBS called him on the carpet, got Jonas Salk on the air, and they nipped it in the bud. And everything went along, and you know the rest of the story with the polio vaccine. This was 1955. A lot's changed since then, right? And now we can't nip it in the bud. As a matter of fact, it explodes, as you saw in the film. And that's where you all will come in, and we'll tell you how in just a second. I want to introduce our panel, and then we've got questions. And just so you're ready, I'm going to introduce all of you, and then I'm going to start with Admiral Schweitzer. We're going to have you do about 2 minutes on where we are now with vaccination in this country. And we're going to have each of you, sort of from your own perspective, give us just a little bit about that before we go to questions, if that's all right with you. So first of all, I'm really pleased. Admiral Pamela Schweitzer, Rear Admiral Pamela Schweitzer is at the far end. And I will tell you a little bit about her. She recently completed a 4-year term as the Assistant Surgeon General and 10th Chief Pharmacist Officer of the United States Public Health Service. She retired from these roles in September of 2018. She had a couple years with Mr. Obama and a couple years with Mr. Trump. Interesting. As Chief Pharmacist Officer and the first female in this role, let's hear it for that. It's fabulous. She was responsible for providing leadership and coordination of the Public Health Service pharmacy programs and professional affairs for the Office of the Surgeon General and the Department of Human Health and Services. Thank you for coming in from Phoenix today to do this. Dr. Walter Doherty, most of you know him. He graduated with a BS in biochemistry from the University of California, San Diego, 1995. Can I say that? Put you out there, okay. Followed by a receipt of an MD from the University of California, San Francisco in 99. Completed an internship in emergency medicine at the Johns Hopkins Hospital. Followed by residency training in pediatrics at the University here in New Mexico, and fellowship training in pediatric infectious diseases at the University of California, San Diego. He also has an article. Remember when I told you he started in 2017 and his students had done this study? Well, the article came out in 2020 in JAMA, correct? And it's called Infectious Disease Outbreaks, Pandemics, and Hollywood: Hope and Fear Across 9 Decades of Cinema. Thank you for doing that, and you got us all into this, and we appreciate it. Dr. Melvina Mccabe, Professor Emeritus, retired of Family Medicine here at UNM School of Medicine. She received her MD from UNM in 1984, completed a residency in family medicine in 1987, and a geriatric fellowship in 1989 here at the UNM School of Medicine. And she's focused her research and scholarly work on American Indian and Alaska Native health and on geriatrics. She's currently the Health and Health Policy Consultant for McCabe CPA and Consulting Group. You recognize the last name? Isn't that your son who kind of runs that? That's good. Good for you. And our pharmacist, Uri Basan, UNM School of Pharmacy, 1998. Nice alum. He was with the pharmacy in Albertsons, and he's just started his own company now, which is just great. We're proud of that. You've also, if you read the New York Times, on Thanksgiving Day, November 24th, article right there, all about him in the New York Times and about the work he's done throughout our state, vaccinating, I think, at least half the state now. Haven't you done it? Including me, including Elizabeth, and we thank you for that. He gave us our boosters a couple of weeks ago, right? Also, he's been on the Canadian Broadcasting Corporation. That just happened this last week, I think. That's fantastic. Anyway, we're really glad that you all are here, and we're glad that you're all here, and you online, thank you for being here as well. So if we can start, Admiral Schweitzer, with you, and just give us a couple minutes of your thoughts. You've seen this a few times. Where are we now? What are your thoughts?
Anyway, it was very impressive, and so every time I see it, I don't get tired of it. I must have seen it, I think, 100 times now. Anyway, I just wanted to say thank you for that. As far as like where our country is right now, you're all healthcare professionals, and I'm sure you're tracking all of it now. We have they're out, the booster's been approved, the pediatric from 5 to 11 has been approved, and we're out, everybody's out trying to get shot in the arms. I know where I am in Phoenix, I volunteer at the MRC, the Medical Reserve Corps, and so there's lots of pods, opening up everywhere, trying to get out there and go to the communities. As far as nationally goes, if you're tracking, how many of you are tracking nationally what goes on, and there's increase? Different in Michigan, our country, so it's moving around, it's controlled, pops back up. So we didn't get as many people vaccinated as we wanted to. We didn't get as many vaccinated as we want to. We still have a good 30% of the people that aren't fully vaccinated. But certain populations are, certain, like the elders, the seniors, there's a higher percentage of them. The children, I'm going to let you talk about them because we still have a ways to go on them. So anyway, we have a long way to go. And I think the one thing I just wanted to make sure that we probably discuss or hit about is where people get their information. And I think that this group, providers, and you talked about it, trust, that is probably the most important thing that we can have for our patients, for our families, for our communities, is to be able to have them trust us and give them good information, because it's really hard for people to find information. I go and ask people all the time, where do you get your information? And if they don't have a good provider, if they don't have somebody that they can trust, they're just getting it from other places than their friends. So anyway, that's my comment.
Thank you, Admiral Schleicher. Dr. Doherty.
Yeah, I love that last comment about trust and finding useful resources. Just to piggyback off of that, the analogy I always like to use is something like cars. I don't know anything about cars. So if somebody says, oh, it looks like you're leaking transmission fluid, I'm just going to go to the internet and Google leaking transmission fluid. And honestly, whatever comes up first, that's what I read, because I don't understand about cars. And so it's completely reasonable that somebody might do the same thing with a COVID vaccine. And so I understand that and get that. And so we need to kind of build trust and lead people to more trustworthy sources. From my standpoint as a pediatric infectious disease doctor, I'm most interested in kids and where we are in vaccination. We just had the 5 to 11-year-old group get the green light to get their COVID vaccines. We have clinical trials for Pfizer and Moderna that are ongoing in kids down to 6 months of age. We have the Moderna trial here now at UNM, and we are enrolling down to 6 months of age. I think I talk about low-hanging fruit and high-hanging fruit. Early on, when a vaccine becomes available, like a booster dose or the 5 to 11-year-olds, you see the vaccination numbers shoot up, right? 5%, 10%, 20%, 30%, and it looks great. What you're doing is vaccinating the low-hanging fruit, the people that want to get vaccinated, the parents that will wait in line at Walgreens to get their shot for their kid. The high-hanging fruit is that maybe 45% that isn't sure they're going to get vaccinated. That's the big challenge. And with kids, you got to go through a parent. It's very different when you're vaccinating an adult. You don't have to convince a parent that their 2-year-old actually needs the shot. And there's 2 components to that, convincing them it's safe and convincing them they need the shot. There was this, although true, somewhat misleading information that came out initially that COVID wasn't serious for kids. It was just older adults that died. Certainly, it's much more serious in the elderly, but we are now discovering as kids are emerging from their year-long quarantine and going back into school and back into sports that they actually can get very sick. COVID was actually the 8th leading cause of death in kids between the ages of 5 and 11 this year. Not to mention MIS-C, multi-system inflammatory syndrome in kids. Kids can have long hauler syndrome, and they can also infect other people. So we have to convince parents that not only is it safe, but that their child actually needs that vaccine. And that's going to be the challenge in the next year or so.
Thank you, Dr. Doherty. Dr. Mccabe, from your perspective.
Please tell me if you can't hear me, because I tend to speak a little soft. You can't. So.
Can you hear her in back okay?
So there was a hand up.
Can you turn her up a little? Is that the wrong?
Thank you. Is this better? Yate, Melvina Mccabe in the shed, a she Hinishland, dog Kiani Washington, I'm from the Benin Nation. I introduced myself with my clans. We are a matrilineal society. So my primary clan is my mother's clan that was handed to me, which is the Salt clan, Ashimni. And Ashimni, by the way, is one of the 4 original clans, the clan that is my mom's and then mine, and all my ancestors before me. My father's clan is the Tari House People clan. And that's my, if you want to put it this way, my secondary clan, but really my other clan, because it comes from my father, so it's not really secondary. But that's how I introduce myself. So thinking about this, where are we now? First thing I want to say is COVID-19 is still with us and is going to be with us. It might be controlled a little bit better in the future, but what we're beginning to see now and think now is the vaccines might begin to look like the flu vaccine, where it's tweaked each year. So it's still here. And I think the other thing that I don't hear a lot is vaccines are critically important. But whenever I give my presentations in Indian country, at Indian conferences, I always say, do not forget, and I see what we're doing here today, this is awesome. Don't forget your masks, even if you're fully vaccinated. don't forget physical distancing. And when that term first came out early on, it was social distancing. I didn't like it. And when I spoke to tribal nations, I said, that's not who we are as Native peoples. That term came from Western society. We are a social people. So the term I'm going to use, and I'm going to start using, I'm doing this as I'm talking to the tribal nations, is physical distancing. And I notice that that is beginning to pick up more now. So that's an important thing. So all of those measures that we have to take have to stay in place, those protection measures. So I think that's critically important to continue that message also, besides the vaccines. So vaccines help, absolutely, but it's those other measures that we must continue. Now, we see this Omicron variant that has come out in South Africa. That is now listed as a variant of concern. Not a variant of interest, but a variant of concern. Because the data that's coming out from South Africa, and it's a new variant, that is coming out from South Africa is that it's more transmissible, highly transmissible. That's the early indication. We don't yet really know about severity because it hasn't been really looked at enough. But that's another one coming out. And the other question we have is the vaccines we have, will they protect that variant now? That mutation is now, variant is now in 14 countries. Canada just had their first case, and that's our neighbor. Some of the scientists believe it's already here in the United States. So where that's going to take us and where we're going to go with that, nobody really knows at this point. I know Pfizer and Moderna are beginning to already tweak their vaccines in preparation of controlling that particular variant. And it's interesting when who took the World Health Organization? I'm not asking a question. The World Health Organization changed the naming of the variants using the Greek alphabet because they thought the public will remember it a little bit better. Well, when the one from South Africa came out, they were going to call it new because that was the next line in line to be named. NU from the Greek alphabet. But they thought, wait a minute, we don't want them to think this is a new virus coming out. We named it that, so they changed it to Omicron. So that's where that interesting name, that's where that name came from. In tribal communities, American Indian, Alaska Native tribal communities, there are studies out there that say we have some of the highest rates of vaccinations in the country. When I have looked at those studies, and this is a chronic problem in Indian country in health, the data is not enough. The data is not sufficient. So when you see a study coming out that says American Indians and Alaska Natives have the highest rate of vaccinations, that might be true for one tribal nation. It might not be true for another tribal nation. There are 357, I believe it is, tribal nations in the United States. So it's not really necessarily generalizable. So we have to be very careful where that data is coming from and how that data is interpreted. The Indian Health Service services only a portion of tribal peoples in this country. So their data isn't even truly reflective of all of us, all American Indians, all Alaska Natives in this country. So look at the data carefully, read it, look where that data is coming from, and then think about that. Now, I'm not saying our rates haven't been high in some areas. Absolutely we haven't. But again, there's still much work to be done, so we can't become complacent when serving our tribal nations. Now, talking about hesitancy. A study just came out looking at healthcare providers. Physicians were 30% not likely, in fact, they said no, to give their child 5 to 11 the vaccine. Nurses, 45% were unlikely to give their child 5 to 11 the vaccine. Pharmacists, 31% were not likely to give their child the vaccine. Within the population of physicians, women were more likely to say yes to their children, 5 to 11, than men were. So again, look at your data. This is just one of the first studies that have come out. It's not written in stone. It'll change, just like vaccine hesitancy, vaccine acceptance, vaccine rejection. That'll change. That's a dynamic process. Some people who say now I'm not going to get it, may in the future get it. So again, we can't really just categorize people into one area and one group. We always have to keep our minds open as clinicians to say we need to keep working. We need to keep working. Trust is huge. Trust is huge. When you look at vaccine hesitancy, the big study from the Kaiser Foundation found out that partisanship was one of the highest indicators of misinformation. Partisanship and vaccination status, those were the two high indicators of misinformation. Those who were more likely to get it. When I say vaccination status, I mean those who didn't get the vaccine. Now, partisanship by itself, that group were more likely to say no to vaccination. And I'm not wanting to say Democrats versus Republicans. That's not what I'm trying to say. What I'm trying to say here is, with those rates so high in our parties, one of the leading reasons for Republicans not wanting it, and this again came from a study, is because they didn't trust what was coming out. They didn't trust the information. They felt people weren't being honest. They felt the scientists weren't being honest. So it's like many, many people in this country, American Indians, Alaska Natives included, high mistrust of anything. But in that particular survey, Republicans were very mistrustful of what was coming out. So when we are working with our patients, we have to listen. We have to be empathetic. We have to ask them for that information. Tell me more about that information. We cannot dismiss them. We cannot dismiss anyone. We have to accept that and work.
And Uri has been all over the state, from Las Cruces to Clovis to Taos to Cimarron to Socorro, as you saw in the film. What have you been seeing? What's going on?
Well, just to tell you a little bit about my background as a pharmacist, we've always been, a part of the multidisciplinary team, and I feel very underutilized oftentimes, part of the multidisciplinary team. And this pandemic has had a lot of positive things that I think have come to light, and one of them is the amazing roles that pharmacists play in the healthcare system, particularly in rural areas like New Mexico. I think right now the statistic is over 60% of the vaccines being administered are being administered in pharmacies. As the statistic was mentioned, 90% of Americans live within 5 miles of a pharmacy. And when you go to smaller towns and villages, often the drugstore is the only healthcare provider in the entire area. And of course, we have extended hours. We're open every day of the week, 7 days a week, evenings, weekends, low barrier of access. You can walk right up to speak to a pharmacist. So we've always had the ability to play a critical role, and we've been taking on more and more of that role with other things that we do in the pharmacy. Started with smoking cessation was, I think, one of our first area of prescriptive authority. And then one area that we really got excited about was hormonal contraception. It's not widely known that pharmacists can prescribe birth control pills. And you just think about how easy it is for a woman to be able to go to a grocery store and ask the pharmacist that prescription, not have to make an appointment and have a medical exam performed on them. What that consequences could be like that for preventing unwanted unplanned pregnancies. So vaccinations have really shined a light on that, especially with pharmacies. The mom and pop pharmacy, this has really helped with their resurgence because they've been struggling to survive against the big chains with the shrinking margins. And so it's really been a boon for the pharmacy business, which is great for society because we play such a pivotal role in the delivery of healthcare, especially in rural America. And so when the pandemic first started, I was already really heavily involved with flu shot clinics. My background was in long-term care, so I worked in the nursing homes a lot. As I mentioned, the wildfire. Every winter, you would get into the nursing home. Somebody would bring it in, and it would just be like tinder. So, starting off the spark, starting off the fire, and it wouldn't burn out until it burned all the way through the nursing home. So I was always really a big advocate of trying to reach the vectors, especially the children. Because, especially in New Mexico, you have the grandparents who watch their grandchildren while their kids go to work. And so vaccines aren't about just the patient, they're about everybody. We want to cocoon people in safety. So I had a lot of experience going to schools to do these clinics. And when the pandemic started, I partnered with the Department of Aging and Long-Term Care Services, and they said, we need help getting vaccine delivery in an equitable way throughout New Mexico. And so we were really concerned about 3 disadvantaged populations, and that was the elderly, people with developmental disabilities, and people who lived in rural areas. All of those people were at a disadvantage of the way the vaccine distribution system worked, right? You had to get onto a website, you had to register. Then, when you got notified there was a vaccine available in your area, you had to hurry up and get on that website and register your appointment, or it would be all sold out before you had a chance. So that didn't really favor people who weren't computer savvy, people who didn't have good internet access. People who didn't live in high-density areas where there were a lot more clinics going on. So we leveraged relationships with senior centers throughout New Mexico, all the way from as far north as Raton, as far south we went to Anthony, we went to Columbus, New Mexico. That was a really interesting one because we did it in a fire station on the border with Mexico. And we opened up the fire station to be a drive-through. So where the fire truck normally was parked, they moved it outside, and people drove through the middle of the fire station. And they normally, to register for a shot in the Department of Health, you had to have a United States address, a United States phone number. So we used the fire station as the address and the phone number. And we had migrants and farm workers coming in literally by the van load. And we would be vaccinating, 15, 20 people at a time. It was a really rewarding experience. And to go to other smaller communities, one of my favorite memories of the vaccination campaign, we went to Springer, New Mexico, and this is the very beginning when the vaccine was only for the nursing home residents. And I had a physician helping me, and we get to the nursing home, we knock on the door, and the nurse comes out and says, you can't come in. Every single resident has COVID. I thought she was joking, but she wasn't. Every single resident there had COVID. We had brought 100 vaccines with us, and we couldn't take them back to the pharmacy, so she said, can we start calling people? I'm like, absolutely. And it was a snowstorm in the middle of the winter, and it was a very small town, word of mouth, and within an hour, we had 100 people standing outside in a snowstorm, waiting for their chance to get a shot. And I will never forget, I gave a vaccination to this cowboy who walks up, he had been like 6 feet tall, big hat, big belt buckle, strong man, and he's like, my parents can't get out of the car. And I'm like, of course. And I give him a shot, and I turn around, this grown man I'd never met in my entire life picked me up like I was a baby, and gave me a bear hug. And I could hear him like weeping, thank you. And so that was just one example of how much people have been appreciative, how much people have realized the importance of seeking out healthcare, of trusting healthcare providers, and being appreciative. And so there's so much polarization in our society right now and so much negativity, especially when you turn on the news. We think that's who we are as a people. But I'm out there every day giving shots, and I get almost nothing but compliments and thank you, and people who are wanting to do more to help. We were at an elementary school last week, and one of the volunteers said, I'm just going to put out a list that says, if you'd like to volunteer, please sign up. And I just thought, okay, that's kind of a cool idea, because we do need help. 100 people signed up at that elementary school. 100 moms and dads put their name down on this list. And then I thought maybe they just did it just to feel good. We started calling them. Almost all of them are willing to come out and go to other vaccination clinics to help out because they're tired of just watching it unfold on TV. People want to help. People want to do things. And so I think there's a lot of good things that have come out of this vaccination campaign. There is definitely a lot of hesitancy and hard-to-reach groups. But I'm even seeing a lot of these hard-to-reach groups come over. There was a very conservative Christian school that they didn't allow me to go there. They would not let me go there. They called me and said, can you please come to us and do a clinic? And we went to the clinic. We vaccinated 60 teachers with their first doses. And you're not giving out a lot of first doses these days, but that day we gave out a lot. And so people are coming around. People, and as you mentioned, you have to meet people where they are. So listen to what their concerns are. Don't tell them they're wrong. Don't tell them, well, I have better information than you have. Just listen to them and say, hey, what I don't think that what you said is 100% accurate. If you want to talk about it, great, but I respect your opinion. And if you ever come around, you know how to get a hold of us. You know where to go. And people are coming around. We've seen the vaccine demand go up and down quite a bit. It was very, very popular last winter and into the spring, and then it fell off a cliff right around May. We couldn't find anybody to get vaccinated. And then we started seeing the mandates, and we started seeing the incentives. And those things all made a huge difference. We did a clinic at the flea market at Expo, New Mexico last summer. In the flea market, I was like, this is not going to be a good place to get shots. It was in August when we were giving out $100. We literally had homeless people on Central coming into the flea market to get shots because they wanted the $100. So, incentives do work. The mandates do work. And there's so many people that come say, I'm going to lose my job. I've dragged my feet as long as I can. And they do work. So I think that it's important. I've been going to lots of events. We can't get in without a card. We went to a flamenco dance we couldn't get into. The state fair. So these types of things do work, and I think it's important that we don't give up on them because they are effective. The more people we reach, it said in the documentary, every vaccine that you give is potentially saving one life. And who knows how many people around them that we're saving as well. So we continue right now. Right now we're back to the boom where we're setting up clinics every day at schools and senior centers. And we create 500 appointments, and 48 hours later it's sold out. So right now there's a huge demand for vaccines. The pharmacies, as I mentioned, giving 60%. They're getting pretty well overloaded at the moment. The demand at the moment exceeds the supply of providers is being exceeded by the demand. But we're getting better and better, and we're going to be meeting that demand, and I expect it to fall back down like it was before. And what we're going to do, just like with the flu shots, is we're going to meet people where they are. We sit inside gymnasiums. It's kind of a funny place, right? Let's go to the gym and sit in the lobby while people are running on the treadmill. That is one of the best places to go to offer shots. Let me tell you, people who go to the gym are health conscious, and they're into their own personal wellness. So we go to churches, and it's always great to listen to the sermons. To go to a different church from a different religion and hear the different messages, that's another great place. Schools are amazing. Senior centers, obviously we're going to a nursing home, to a skilled nursing facility tomorrow. So there's lots of good places, and that's what we're going to do. The demand is going to drop off soon, and we're just going to go to wherever the people are and lower the barriers to access and just take away all their excuses. When you're standing by the time clock and somebody goes to punch in, it's hard for them to say they don't have time. Punch in. Your employer's paying for you to do this. You have time. So that's where we're at, and I'm really happy to represent pharmacy and pharmacists, and I hope to continue to further our profession as being, integral parts of a multidisciplinary healthcare team.
Boy, do we have some great folks here. This is going to be, absolutely. So, just so you know, if you were all producers and you heard all this, what would you use in the show? It's like, I want 3 hours, I want 5 hours. It's great. And one other mention, Dr. Doherty, did it just finish the study you just did with the Moderna and the young kids?
It's ongoing.
It's still going, but you're working on that right now, right?
Yes.
That's cool. All right, we've got some time. We've got about 20 minutes or so, I think. What kind of questions do you have? Okay, good. We solved it. We're good. We're in good shape. And one question that somebody always asks, I get to answer this, I'm just excited, is how do you convince people who are hesitant, right? And the question, and you've heard it here, is you have to know who that person is, right? The target audience for this documentary, we spent about a year and a half figuring out the target audience. Well, this one was all over the place, right? It's all over the place. So what's interesting is we were Dr. Admiral Schweitzer and I were at a screening in Phoenix, and it was Dr. Baker, wasn't it, who said, and he said, this is the best advice if you're trying to convince somebody, and we all know people who are not. He said, you have to learn how to dance with them. Everybody kind of opened their eyes, what are you talking about? And he said, no, everybody dances a little bit differently, When I met my sweetie, she's Colombian, she dances a lot different than I dance, right? And we have to figure out how to make the moves, right? So, and he said, let me explain that. He said, he was talking to the Arizona State University football team. They had a 14% vaccination rate. And he told them all about it. He had all the charts and he put the things up and he's showing why it's safe and how long mRNA has been around and why it's good and all the people who are dying. Blank. Nothing was happening. It was not going to happen. And he finally realized, I'm not dancing with these guys right. He finally said, you know why you should get the vaccine? Because Ohio State's football team is 85% vaccinated. The next day, they had a 75% vaccination rate. So that was a great lesson. All right, what questions do you have? We got all the experts here. You got to have some questions. And thank you for student putting through this thing. He's a hero. This is great. Questions?
I have a comment.
Yes, go ahead. Yeah, I'm going to run this over like Phil Nelson. For those of you old enough, I didn't know Phil Nelson. He was from Hawaii.
So part of it is always being action-oriented, putting this together and what can we do to make a difference. And part of what is also comes with this, and this is my little marketing thing here for you, that comes with the documentary is that Chris took out like segments. They're called lift outs, but little videos. They're 30 seconds, a minute, couple minutes on different topics, and he highlights them. And they're real short. And right now, I pulled all the ones about kids because I'm sending those to people. Hey, look at this, and it has the ones addressing the kids and the history of vaccines, and shows the kids getting their vaccine in their arm. So we pull the ones with you speaking on it, but there's really good messages. He pulled them out and made them in these small segments. So the thing is, what can we do? And there's lots of places that they can be shown and shared with. They can be shared individually. They can be shared if people don't want to watch the whole film, or in waiting rooms, or just anywhere. But really the purpose is being able to help have a conversation. So even if you're going to, by the way, you're extremely passionate, it's really exciting to listen to you. And exactly what this is exactly the vision, I'll be honest with you, that we wanted pharmacy to do, and you're doing it, so I need to visit with you later. It's really good. So just putting it out there so people can have a conversation, because people will have questions, and they just need to be able to be comfortable and have that trust to be able to ask them. So anyway, part of that, and then where can be that trusted source? The other thing, if there is any way that you can counter, there was a saying in there, what is false information flies by, it comes by, and then the truth, it takes a while to counter. And I remember even now, to this day, every day, there's something that comes out, and my daughter brings it to me all the time. Mom, this is what they're saying. She goes on internet all the time and the social media. And it takes me a couple days to go find the answer, because some of it's like, okay, well, where are they getting that from? And then by the time you respond 2 days later, it's already taken a life of its own, gone to so many people. So we need to figure out lots of people are getting their information, and it spreads way too fast. So you probably know a lot of what you talked about in flu vaccine. I'm hearing that for this COVID vaccine. Same exact thing. I'm getting, it's like it's causing these other diseases. It's exactly what you just said. It's like deja vu.
Just to follow up on Admiral Schweitzer too, this website is available, themisinformationvirus.com. Themisinformationvirus.com. You can download all the things, and I just showed them that. There's also this, which is a viewer guide, which takes you step by step how to do exactly what you guys did here, and how to use the viewer guide in small conversations in your PTAs, in your church groups, whatever. It's all here, and all those little elements. You probably noticed it in the film. There's just little pieces that we pulled out. They're in Spanish. They got Spanish subtitles, and they're in English. Go ahead, Walter.
Yeah, one quick comment, just building off of what you were mentioning about monitoring this and how it took you 2 or 3 days to find something. There was an article in JAMA that came out where they were proposing this idea of a social media outbreak service, where you would actually have trained physicians and people that were experts in algorithms of social media and whatnot that would monitor Twitter, Instagram, Snapchat, and Facebook, and look for misinformation that was being posted and amplified. And when particular rates were hit and would get flagged, immediately sent off to this service who would find an expert who could then immediately in real time launch a counter campaign of accurate information. So it was really called a Misinformation Outbreak Investigation Service. So treating the misinformation as an actual outbreak.
That's excellent.
Oh, one more thing. For those of you.
There's a question. He's got a question.
Oh,
Yes.
question. Okay.
Go. Question. Fabulous.
Well, it's a comment and a question. There's a tremendous amount of positive energy up on the stage, and I think it's just fantastic. I'm a pessimist by nature, and so allow me to throw some cold water on all this heat here. I don't think we really have on a lot of the social media and misinformation that is out there. I've had these experiences that you describe of patients just being so grateful to me for, I was at the pit every Friday with the vaccination drive, and boy, those people are just so happy to be there. But all those other people out there that we don't see, it's easy to be in this echo chamber where, oh, this is wonderful, this is so wonderful. I think what Walter was just describing now is more, for me at least, along the lines of something that, the way I think. How do we actually monitor this stuff and then counter it? Because I think it is so much more powerful than many of us really appreciate. And it's easy for us to say, isn't this wonderful? But this is, and it, I don't mean to, but I just like throwing a little bit of cold water.
Well, and let me, just one quick note about this, because when we started the film, we were trying to figure out, we were in these think tanks saying, okay, how can we do this? When we started this thing, the initial thought, at least mine, being a non-doctor, was, okay, we're going to say, here's what people think. They think there's a microchip going into their arm. And we'd have somebody saying that, right? And we've come across those people, actually. And then we will, in the film, dispel that with facts. And whatever the thing is, we'll dispel it with facts. And just so you know, that does not work.
Yeah, facts,
It's amazing. All the research out of Berkeley and everywhere else, that doesn't work at all. That's why we tried to put in some anecdotal things. It's much more likely that if it's a family thing, if you're protecting your family, if your heart is engaged with the woman who almost lost her kid to measles, you might think about it a little bit more. If we can pull them in some way, heart-wise, I think that's probably a good way to go. What were you going to say?
Yeah, I was just going to make, I really like your idea if there's a way to implement, having the counter, because there's a science behind how they can take the information and when it comes out. And you probably see it now. I know every single time the CDC puts something out, I know what they're going to say. So remember back when they approved the vaccine and they said, oh, wait a minute. Well, you knew exactly, well, it's dangerous. You knew that they were going to take and twist it. So anytime something comes out, the booster, you can almost anticipate what the next thing. So you have to almost be watching for it, and then it's going to come, and you have to be ready for it to counter it. So it's because science is always evolving and changing, not black and white. And I think that one of the things is people need to realize that. That wasn't what I was going to say. Oh, I just got sidetracked.
Oh, do you want to finish? Go ahead and finish. You got the mic, and then we'll go to Dr. McCabe.
This is not about me. Pass it over. I'll do a round after me.
Okay.
I think, again, if we can remember, because this is what I was taught as a Navajo woman, that our words are powerful. Our words are powerful. So when we say, when we're talking about this issue now of COVID-19, we say, how do we counter that? That sets up a problem right there. It's not a matter of countering. It's a matter of being in that place with whomever it is because each one of us has our own story. It's understanding that. I'm doing a cultural intelligence training with American Indian, Alaska Native as a perspective for, or I'm hoping to, for the Albuquerque Police Department, on how they can improve their performance with American Indians, Alaska Natives. So in that, what I want to do is if people can understand where truly you come from, meaning me as a Native person, what my history has been, the historical trauma, I mentioned that, the impact of the policies of the U.S. government, the development, therefore, of health inequities, mainly because of the social determinants of health, and what we had to go through because of that, and how that impacted us, our suicide rates, our alcoholism rates, our high rates of diabetes, our high rates of renal disease. All of those things, for me, it's to understand. It's to understand that we need more of that educational component so that we know exactly, that's the cultural intelligence part, of what that other person is going through. It's not a matter of countering. It's a matter of sitting down, as I heard was said here. He's doing it in a broader sense, but individually. And I can give an example from my personal life. One of my relatives, we were at dinner, and she's a healthcare provider. She absolutely did not want to get her daughter vaccinated. And I think she's 8. And so we were just sitting at the table, and I said, help me understand this. I said, I'm wondering how that decision came about. Help me understand. And so she told me. And what came out was misinformation. Absolute misinformation. And so I didn't challenge her. I didn't counter her. She said, for example, well, all the kids especially in Texas, they're dying from cardiomyopathy from the vaccine. And it's not cardiomyopathy. It's myocarditis and or pericarditis. They're not dying from that either, from the vaccine. But that was like a whole another part of misinformation from my family side. And so, when she said it was cardiomyopathy, I said, oh, I see. You're talking about myocarditis. And so, I didn't dismiss her. I just said, oh, myocarditis. A week later, I was informed she got her daughter, my niece, first vaccine. So this is what I mean by you may not see the impact. You yourself may not see it, because I wouldn't have known that my niece got the vaccine until someone else in my family came to talk to me about it. And I was so happy. But this is what I mean by connecting, by truly connecting and getting out this domineering, countering thought that we tend to have, that I tend to see, having been in 3 cultures, Western medicine, Western society, my own culture. I see the differences. I also went to boarding school. I know exactly that experience. And I know exactly what that's all about. So when I hear people talking about boarding schools and not understanding it, I just think to myself, how can you really talk about this when you don't really understand it? Again, it's that lived experience, knowing what that person has gone through, knowing what their lives have been like. And I'm not saying it's easy. I'm not saying it's easy at all. I did this throughout my life when I was here at the university, seeing patients. But it works. And if each one of us did that, we really might then begin to see it instead of as this against that. This side versus this side. So I just wanted to make that comment, to say we really have to look at how we approach one another.
What wisdom we have here. Thank you. You all have spent a Monday evening with us, and we so appreciate that. I have a feeling our guests will be here for a few minutes if you want to come up and talk to them. Again, I want to thank Dawn and the School of Pharmacy for putting this together, and I will take a quick picture as we're looking like we're doing something so we can do the advertising. Go back there. Let's do one quick picture. Dawn, come up here like we're talking like each other. And we're just like having this conversation, and you got the thing here, and everybody's looking. You guys are happy, and that's a good thing. You got it? Good. All right.
So I want to thank everyone for coming out, or whoever's tuned in the Cyberverse. So I was at the UNM Alumni Awards just about a month ago probably, and Chris came up to me, because I already watched it. I watched the video when it first was on in Mexico PBS. I saw the documentary, I loved it. And Chris came up to me and said, we'd like to do a screening with the college. That's about when I said yes. I didn't even let him finish. I said, let's get it arranged. Then I watched it, I watched it again, and I was like, who would be good to have on the panel? And I'll tell you, I was getting my COVID booster, and I was going to email Ori and say, would you come and be a panelist? And next thing you know, I'm waiting in line at the booster clinic, and I see Ori with a clipboard. And I was like, nah, this is like kismet. So I asked him, he said yes. I emailed, Dr. McCabe, Dr. Uherty, and Dr. Schweitzer. Without hesitation, they all agreed to come. Even Pam flew in from Phoenix. And again, I want to thank you all for your generosity, spending your time, the wisdom, the things that you said. I think it's very important. Ori, I'll give you the $20 later. He had all my pharmacist, talking points. So that was a good job. Actually, he did it all on his own. I knew it again. I stood quick. I started here in 1996. And he graduated in 1998, so he was one of my very, very first students. And I remember him distinctly. He was a great student. He was very supportive of the college. He was always at our career fairs, for many years, either Albertsons or Omnicare when we were working. And now he's doing this. So I'm always very, very proud of my alums. And if anyone who knows me knows that's true. And you're doing a great job. But again, I want to thank you. And I also noticed, just when I was sitting here, I was like, we have a nice interprofessional panel. We have 2 physicians, we have 2 pharmacists, and I'm also very supportive of interprofessional education.
And a TV producer.
And a TV producer. So again, thank you all. Again, feel free to ask our panelists any questions afterwards. There's probably food still left, I guess. If there's any food on the way out, feel free to grab yourself a plate. Technically, if there's still any students in the audience, definitely. I remember those days. Feel free to take another plate. Again, thank you. This is exactly what I wanted, and I appreciate it, and hope everyone has a great evening.